Ladies and gentlemen, welcome to another very exciting episode of Therapy Tea Time Talk. So this is series number 2, episode number 2. So we have another very exciting guest coming up onto our show today. She is a Doctor of Chiropractor and also a Master of Science, specializing in clinical anatomy. So without any more further delay, welcome to the show, Dr. Kathy Dooley.
Hello, hi, how's it going?
Going very, very well. Thank you very much. How are you doing?
Oh, great. So glad to be here with you.
Thank you very much for taking your time to come up to our show today. It's an honor to have you today. All right. So what we're going to do is start off with some questions for you here. So the first question I have for you today is, what is your profession again, and how long have you been doing that for?
I have been a chiropractor, so I have a doctorate in chiropractic, and I achieved my degree in April of 2007. So it's been, 13 years, which is shocking that it's been that long. And right after that, I studied, I got a graduate degree in anatomy, as you mentioned, and I have been an anatomy instructor in human dissection also since 2007. So 13 years for both.
So how did you get started in the beginning? What led you to want to study this originally from the start? So take us all the way back.
Oh, wow. Yeah. So basically 20 years ago, I was having panic attacks, and I was studying nutrition at the time because I thought I wanted to be a nutritionist because I was really interested in health and fitness. And I was getting really, really uncomfortable panic attacks. And someone had mentioned to me, you should go to a chiropractor. And I thought, well, my back doesn't hurt. What does that have to do with anything? And she had said to me, no, it's the nervous system. There's a balancing that needs to happen in the nervous system. And I was like, really? And so I started going to a chiropractor, and she was enormously helpful with the panic. And I became one of her interns, and then she wrote me a letter of recommendation. So I went on the path of chiropractic, and it was wonderful. The schooling was wonderful. And while I was there, I got bit by the anatomy bug. I became an anatomy tutor, and then you think that I'd be done after 5 years of chiropractic school, but I wasn't done. So I decided to go get a master's degree in anatomy to learn anatomy better and deeper, and that's what I did.
This is a very, very comprehensive beginning, all the way from the start, from doing nutrition, and then you're doing chiropractor, and then you moved on to doing anatomy afterwards. I mean, it's a very, very a big change at the same time, but you definitely don't know a lot of things. So what I wanted to ask you next is, so what type of setting are you based in right now?
Oh, I just moved. I was in New York City exclusively since 2011. So after I got my anatomy degree, I moved back to St. Louis, the school at which I got my chiropractic degree. And I taught there for about a year, and I really missed New York because I had been doing externships in New York at some of the medical schools, and I missed it. So I went back to New York, and I was there from 2011 until just recently. And I opened a gym in Midtown Manhattan, and I started a seminar series, which was really great, started teaching for seminar series, and then also started my practice. And then I started teaching for the medical schools. So I was working 10 jobs at once and just loving it and having such a ball. And I met my husband about 4 years ago, and we decided to move to Boulder one day, to Boulder, Colorado, and kind of slow things down, and so that I could concentrate a little bit more on creation for some of my work. And that's what we recently did. We've just moved here 4 days ago, and I'm still practicing in New York. I go back every 2 weeks and see my patients, but during the pandemic, it's been mostly telehealth. So I see a lot of my patients online. And then I also run my seminar series online. And it's been a really strange 3 months of that accommodation for telehealth. But I've been so lucky because I do study groups for my courses. And so I had already knew how to do things online, and that was really, really helpful. So I would say that I'm based in Boulder, but still have a foot in New York, and I still teach for schools in New York, but I'm looking to build something more also here in Boulder.
And what is your role in the healthcare system?
Well, I'm a chiropractor, obviously. And so as a doctor of chiropractic here in Colorado, I can do, I'm board certified in physiotherapy, board certified in acupuncture, and of course, chiropractic. And then in New York, I only do chiropractic. I'm not allowed to do acupuncture there because acupuncturists have to do acupuncture. So the laws are a little bit different. And I worked for medical institutions. So I basically worked for 4 medical institutions as an anatomy instructor. But my major role in the healthcare system is as a chiropractor.
So this next question may be redundant, but maybe you can elaborate a little bit more further on that for us. Because we know that you moved from all the way from basically transition from being in the health profession or the nutrition area to starting to become a chiropractor. So I was wondering, can you give us a full breakdown of your story of how you originally started all the way from the beginning? And for example, how did you get into let's say the fitness industry in the beginning and the nutrition area?
Okay. So I'd always struggled with my weight. And so for me, it was really, really hard to maintain a healthy weight. I would yo-yo a lot, and I didn't really understand what it was like to be fit. And at a younger age, in my early, late teens, early 20s, I had suffered from an eating disorder. And so I was trying to find a healthy relationship with food. And I thought that studying nutrition would help. And it did. As a chiropractor, I'm allowed to also treat people with nutrition. So I wasn't put in a box of just doing nutrition. With chiropractic, I could do rehabilitative strategy, I could treat holistically with acupuncture, and then I could also help people with nutrition. And so for me, being a chiropractor was this autonomous thing where I could help people be fit, help them know what to eat, know how to take care of their bodies, know how to move better. And I had this big, wide scope, and I was really interested in being a holistic practitioner. And chiropractic it still is just the most wonderful ability to be able to do that, especially in a state like Colorado, where I have a lot more ability to have a wider scope. And for me, it's been a significant piece of life being able to be a holistic practitioner, as I've seen a lot of Western medicine is very specialized, where you might have a gastroenterologist and you might have an endocrinologist, and the two people may not even be conversing, even though they're treating the same person. So I wanted to be a holistic overview for someone and really help them with the nutritional part. And for me, that led right into fitness. And so if I was watching nutrition and I was doing human movement rehabilitation, it really put me towards kettlebells. And so I got kettlebell certified, and that is my primary mode of fitness for myself and what I help encourage my patients to do, because I'm also a kettlebell instructor and I own a kettlebell gym.
And then moving on to the next stage, and then you went to the chiropractic school, and then after that you actually started teaching anatomy as well, right? And studying anatomy. Can you tell us a bit more about that, and tell us a little bit more about how you got into, for example, more of your further studies into the anatomy portion?
Yeah, of course. When I was in chiropractic school, I was an anatomy tutor, and I enjoyed it very, very much, and realized that when I graduated, that was the thing I was going to miss the most. And I love being a chiropractor, don't get me wrong, and I love being a rehabilitation specialist, and movement rehab is a big part of what I love. But I felt I would never really be as good at it as I could have been if I didn't study anatomy deeper. And I knew there was a lot more to learn. So I decided to apply for a master's degree in anatomy, and it was dissection based and thesis based. And I'd never done research before, and I'd been part of a research team as a chiropractor, which was great. We won a research award, which was awesome, but I had never done my own research for myself, and I thought that would be really interesting. So basically the master's degree was intense. It was dissection based, and I had to teach at the same time. So I was going to school and I was teaching, and the practice kind of was very small at that time because there was not a lot of time to do it. But I really, really enjoyed going in very deep with anatomy understanding. What I started to find was the deeper that I understood anatomy, the better practitioner I became, the better diagnostician I was. And I started to see how the common foundation was an anatomy for all health fields. And then I was really inspired by it. So I had a very arduous 3 years of externships at different colleges. I worked for 4 or 5 different schools, and then one major school, New York College of Chiropractic. And it was wonderful experience. And then after my 3-year fellowship, I decided to practice and teach at the same time. So my life got really, really intense. It was when I lived in New York, it was, moving back and forth to different colleges as I was also practicing in between. So on a given day, I would be, getting up super early to practice and then then going across town to teach anatomy, and then going back to my practice, then going back to another school to teach anatomy. And then it would be like sometimes 16, 17-hour work days. And I loved every second of it. I really enjoyed it.
It sounds like you definitely have a longer work day than well, at least definitely more than me. Because 16 to 17 hours is a lot.
It was like that for a long time, I'll admit. From 2011 to just recently, it was 7 days a week and lots of travel worldwide. And with the life changes that have occurred for all of us in the last 4 months, you start to reflect on some things, and your life changes and you roll with it.
I guess at the same time, when you spend more time also with yourself, you kind of begin also finding or discovering new things about yourself as well, right? Maybe some things different things you might be interested in different areas too. Would you agree?
Yeah, totally. Yeah, I found that I was, with the pandemic, it really made me understand how in love with movement rehab, kettlebells, and anatomy I really was, and how effective we could be on telehealth. I was, I had designed a seminar series that was based upon not doing as much touch, but watching and listening, and then also touching. And because I had that skill set, it was such a valuable piece in telehealth, because I'm really into helping a patient educate themselves and empowering them to help fix themselves. And it sounds like a terrible business model, but it's not. It's kept me really, really busy. People are like, oh, well, they can fix themselves. What do they need you for? And I'm like, well, if, the average person, the average population, like only 10% of people go to chiropractors, what's happening with the other 90? I think that we can help people to help themselves, and they'll come to us as an envoy, as a guidance, as a mentor, and not always a Band-Aid.
Now, because of your expertise extends in a lot of different areas, I was wondering, how has your methods of diagnosis and treatment, or coaching in this case, changed over the years?
Significantly. I've gravitated towards a couple of different seminar series, and when I got frustrated with there was an incomplete piece to the seminars I was taking, I decided to start my own. And that has been like a big chunk of my focus. And so I teach for 2 seminar series, and both of them are like integral to what I do. And so I found myself shifting from the typical, what I learned in chiropractic school was like, you follow this regional exam. And I still, of course, do a regional exam, but it's this expedited version. And now I focus a lot on human movement and watching movement assessment and looking at the anatomic basis behind human assessment. And it has been so wonderful for my patients and I. We are a team in helping them help themselves. And so I would say it's changed significantly. And the fact that my rehabilitation strategies are highly anatomically based. And had I not gone through what I went through, I don't think I'd be able to help people at the level that I can now. And I don't think everyone has to go get a master's degree in anatomy. That's not the point. The point is, I want them to learn from my struggle. I want them to learn from everything that I went through, and I want to make it easier for other people.
So in that case, approximately how long is each one of your, let's say your sessions?
Depends, but typically my sessions are 45 to 60 minutes. The average session's 45, like for existing patients that come back, it's usually 45. We get a lot done in 45 minutes, and my patients would probably tell you that 45 minutes is the limit because it's a lot of self-reflection. It's a lot of work. I'm asking them to kind of break themselves open to new possibilities. And some of the strategies that I have them do are really not only cerebrally challenging, but physically challenging. I'm trying to help them be neuroplastic and break through human behavioral patterns that don't necessarily fortify them anymore. And when they have to break up with those patterns and build new ones, it can be really fatiguing. So I try to not overwhelm my patients, although I think it's my nature to want to give so much information out. I'm working on trying to, as my colleague, Dr. Anna Folkmer says, she says, slow drip. give slow drip to people. You don't have to like shoot them with a fire hose. And she's right. Like if I can just slow drip a little bit, but also give them, opportunities to learn more if they want to, it's really a wonderful experience. So I would say 45 minutes is plenty, but for a new patient, usually I'll do between 45 and 60 minutes.
So in that case, what is the approximate like split ratio in the class? Like how much of it is going to be history taking, how much of it is going to be the actual diagnosis portion, and how much of it is going to be the actual treatment?
Well, the diagnosis portion starts immediately with your assessment process. Like when you start listening to the patient, and the better you can listen, that auditory inspection is a huge piece to where you want to direct your diagnostics. I've developed like flows and charts like for my students and for my colleagues to follow that are standard operating systems. And I do follow like a pilot's checklist, if you will, of standard operating system. And so it doesn't take me as long as I think it may take some other practitioners to get there. And that's really what fires me up, is helping other people become faster and more efficient at what they're doing. And so I would say the listening portion is the biggest piece of the 45 minutes. It's probably 15 minutes of it is just listening. And then that doesn't stop. As we're working, I'm still listening. I've learned in my older years to speak less and listen more when it comes to the patient, and ask them questions and really get them thinking. And they're like, oh, I haven't thought about that before. And they'll start sharing things like, wow, I didn't think my right ankle sprain had anything to do with my left knee problem. And I'm like, well, it might actually. And so I would say 15 minutes is probably listening. And then, probably 5 minutes into that is the standard operating system. It's pretty fast actually, if you're listening and palpating and really hearing. And then the bulk of the rest of the visit is getting them to strategize. So it may be manual therapy, it may be a lot of it is spent with them doing things and me teaching them how to do things, and watching and assessing during that process too. And that can be very diagnostic. So I would say half of the visit is them working really hard.
So which leads me to my next question now, because I understand that you have a very holistic approach when it comes to the treatment. So in that case, do you give your clients like homework as well, or corrective exercise to do at home?
Yeah, without question. Every single patient gets homework. I'm not a passive type. I'm not the person that's going to sit there and just adjust them and then get out the door. And for me, that didn't work in chiropractic school. That something was missing. I was like, well, chiropractor means hand practitioner. I get that. But if they're coming back to me with the same problem every week, what are we fixing? And that was really bothering me in chiropractic school in the very first week. And so I had a chiropractor that would give homework. And so I knew that I was going to be a real rehabilitative chiropractor, that it was not going to be 5-minute sessions. It was going to be 45-minute sessions. I knew from the very beginning that it was going to be like that. And I've been very lucky to be in situations, or I've gravitated towards situations where my employers or me as a self-employed person would be able to create that situation. But to me, it's non-negotiable. Like, if you're not willing to work on yourself, why should I work on you? Why should I waste my time?
So would you agree that like patient education is one of the very important aspect when it comes to treatment as well?
Important aspect. The number one. Doctor means teacher. It doesn't mean fixes your problems. It is docere from the Latin, to teach. And so for me, it's non-negotiable. I didn't want to be someone's Band-Aid. I don't want to give them a fish. I want to teach them how to fish. I want to teach them how to help themselves. My best moments in clinical practice are the people that get better, and they just send people to me that are like-minded, that are willing to do their homework, that want to get better. And they'll say, like, I saw Kathy, I don't have to see her anymore. That's like the best thing ever. I don't want someone to tell me like they've had to see me for years to get to the root of one problem. That it doesn't seem right to me. So patient education is the only reason I'm in this. As an educator, like I've always wanted to be an educator. I wanted to help myself first and then help everybody else. And I think that it's non-negotiable in my practice.
And are there any advice that you can give people that are new to your field?
To chiropractic, or to movement rehab, or to fitness, or to all of them?
All three.
I think the best advice I can give is be a mirror. Like, a lot of practitioners are expected to be perfect before they do anything. And I think it's so much pressure. I think that my patients have really enjoyed hearing about my struggles. And I tell them, I started with myself first. I am in this profession because of all of my hardships. And it's my honor and privilege to help you with your hardships, just like I was helped. It's kind of like you're paying it forward and you're passing on the love. And I think that you don't have to pretend to be perfect. You can be in practice, helping them be patient. And I think that if you remind yourself that you're in practice, that you're growing and burgeoning and you're self-reflecting and you're being a person's mirror, I think that can really take pressure off and also inspire you to help yourself so that you can help others.
And now if you can go back in time to give yourself one piece of advice, what would you give yourself?
The biggest reflection I have, I don't think I would change anything, so I wouldn't be where I am today, and I'm really happy with my career. But if I could give my young self a piece of advice, I would tell her not to diet. I would tell her not to kill herself working out all the time. I would tell her that training, fitness is to build you up and not to break you down. It's not to burn calories. It's to build internal fortitude and strength and power. And I wish that she wouldn't have been as hard on herself as she was.
Thank you so much, Kathy, for sharing your story with us today and also sharing some of your experiences with people that are new to the field in all three different areas. That's all the time we have on the show today. Again, I wanted to thank you again, Kathy, for coming up to the show. And this is Therapy Tea Time Talk, series number 2, episode number 2 with Dr. Kathy Dooley. All of you can learn a lot from her, and I hope all of you have a lovely day.
Thank you, Richie.